Hey, I'm Dr. Rich, teaching you about dentistry and teeth so you can have a very nice smile. Had an interesting case that came into the office recently that I want to share with you guys, and also discuss this topic that I get quite a few questions on, which is how quickly will teeth shift after you have a tooth removed? And my answer is always, well, it depends. It depends on the situation. It depends on the person. It's going to vary from person to person. And some people happens right away. Some people it doesn't happen at all. It'll be years and the teeth will barely move. So this case that I had this week will be fairly interesting in that fact it'll kind of illustrate what'll happen. So let me give you some backstory on the patient. This is a patient, they've been a patient of mine for quite a long time, since I took over the practice in 1998. So they were a patient of the practice prior to me. I'm going to show 3 different panoramic images from over the years for this person to kind of illustrate how their teeth shifted. All right, so let me pull up the first one. So this x-ray is from 2009. So this is the oldest panoramic x-ray that I had for this person. As you can see on the upper jaw, they're missing their upper right wisdom tooth, and then on the upper left, they're missing the second molar and the wisdom tooth. On the bottom, they are missing a premolar on the lower left and on the lower right, but otherwise they have all 3 molars, the first molars, second molars, and the wisdom teeth. So we took this panoramic x-ray in 2009 because they were having some trouble with a wisdom tooth, and it's this one right here, tooth number 17. So that was their lower left wisdom tooth, the very last molar. As you can see, there's darkness all around the root tip. The tooth was a bit loose. You can also tell that it's shifted up into the space where the upper molars are missing. So on that visit, we had to remove that tooth. We extracted that tooth. Okay, next from there, let me move on to the next image. So this panoramic x-ray is from 2014. On the top, again, no changes. On the bottom, looks pretty much the same. That wisdom tooth is missing. We extracted it after the last panoramic, so this is 5 years later. And I'm going to put them side by side so you can kind of take a closer look at the 2009 image and the 2014 image. And what we're going to focus on is just kind of the spacing between that first molar on the lower left and the premolar, and also the spacing between the first molar on the lower right and that premolar. And to my eye, maybe there's a little bit of difference on the lower right hand side, but the lower left hand side does not look that much different. So after over 5 years, a little bit of shifting on the one side, on the right, very little on the left side. So 2014 was the last panoramic x-ray I had for this patient. They were due for their next panoramic image around 2019. I'd like to take them every 3 to 5 years, depending on the situation. This person's been fairly stable, but they ended up having some health complications in 2018, 2019, needed some major surgery. And then 2020 came, and everyone knows what happened in 2020. We were shut down for a few months. A lot of people got off track with their dental care and haven't been back. So now it's 2023, and this patient finally came back. They've had some more health issues with their heart, other issues, not dental issues, but they came in. When they called, their biggest problem was that they're having problems with their teeth. They have some bad teeth. They have a bad tooth. So we took a new panoramic x-ray, and this panoramic x-ray is from 2023. Just took it just this past week. Again, the top, not much has changed. Still missing the same teeth they're missing. On the bottom, though, you will notice a bit of a difference from 2014. So prior to our shutdown in 2020, This person ended up losing a couple teeth on the lower right. I had pulled the first molar and the wisdom tooth at different times. But what brought him into this week was the lower left. As you could see, that those two molars that had been fairly steady there have all of a sudden shifted quite a bit. They've tipped forward into the space in front of them. So if you look here, the first molar is, laying down pretty much. It's almost touching that premolar there, and then that second molar followed it along, and it was the second molar that was bothering the person because it was very, very loose. If you look on the x-ray, there's actually no jawbone holding that tooth in. It's just in the gum tissue, in the mouth. Clinically, it was very inflamed, a lot of plaque and tartar on both of these teeth because the teeth were getting loose. They stopped brushing and cleaning around them because they were worried about it. So both this tooth, that second molar that's not attached, and then the first molar too, because it's a laying down, it's going to need to come out. It's got what's called a radiolucency in between the roots right there. That basically means there's no bone in between those roots anymore. And so I recommended that we take both of those teeth out, and we did. So 2014 to 2023, so that's 7 years, we had quite a change on that lower left-hand side after it being stable for quite a while. I'm going to guess that part of the reason too is the health issues. They had some difficulty maintaining their teeth as they should have. And also during the shutdown in early 2020, I think the person just wasn't able to clean well in that area. They weren't able to come in for cleanings, and this is what happened. So I did remove the teeth. I have some pictures with the teeth right after the removal, right after the extraction, but I'm not going to show them because YouTube hates the sight of blood on videos, and I don't want my video flagged by YouTube. But here is some video of the teeth after they've been cleaned up. Basically, I just soaked them in bleach overnight to get all the blood off them, just to make them a little bit more presentable. So this is the upper of the two teeth. So this is tooth number 18. On the panoramic x-ray, it was kind of floating above tooth number 19. So all this stuff down here, this is all plaque and tartar buildup that's on the root because the tooth was only loosely held in by the gum. There was no bone around it. You can see it's got an old silver filling. We call this a mesial occlusal because it goes in between the teeth. So this one came out very easily in a couple seconds, just had to grab it and pull. Very little blood on this one too when I removed it. And then this is the one that was below it. So this one ended up cracking when I removed it just because of the angle it was in. So this was sitting there. This one was up on top of it like so. Again, a lot of plaque and tartar on it. I went to remove this one and the distal root cracked. So actually when I grabbed it with a pair of forceps, cow horns, I thought I was able just to get the whole thing out in one piece. It's got an MOD amalgam and a buccal amalgam. But I ended up just getting main part of the tooth and the mesial root of the tooth came out with it. The distal root snapped off and was still caught in there, so I just had to get a different pair of forceps to grab it. You can see there's the nerve chamber right there. And also right in there. Beautiful. Patient came in thinking they were going to lose one tooth, and they ended up losing two.